So I started out with you know, talking about this, which is the liver, which I believe, correct me, uh, is that that's kind of where everything started from, as far as hey, let's see,
Yes,
how can we,
I'll give you
yeah,
a quick
give me the
background
background
on
before we kicked off
so
here.
the creator of this company and this technology is an engineer in complex computer systems. And his mother has MS, and so he's always had sort of this side interest in neurology and neurophysiology. And he kept thinking, for mom, I'm going to figure out when they come up with a cure for MS, I'm one of the first people to know about it, and then I'll bring mom to that doctor. That was always sort of his thought. And so he reads all the, like, just like you and I might watch sports or have some other interest, he reads neurology journals from around the world, especially in the Eastern medicine, because they do a lot of reflexology and acupuncture and all this kind of Eastern medicine. So he reads the Western and the Eastern literature, which is unique because most researchers stick to their silo. They don't really know what other past thoughts are. And so as he's reading along, he starts realizing, I don't know, when you do acupuncture or acupressure or reflexology, you're applying a pressure rate, a skin sensation to one part of the body, and it seems to be affecting a completely unrelated different part of the body. And so he started following a lot of this science. There was a paper that came out that sort of defined how the autonomic nervous system is what is being tapped into when you do something like reflexology or acupuncture, acupressure. You're tapping into the autonomic nervous system through the skin, going from the skin to the brain's transmitting it, a brain signal changes.
Right.
So he decides, because of reflexology, to see if he could figure out how that worked. And so he purchased a database of EEG receptor, the largest database of EEG. He wrote a computer program to interpret the data of all the little squiggles.
Yep.
And then basically made an easy to see interpretation guide where there's normal, took all the normal ones, put those in a range, and made those like a green color. So when the squiggles are in that range, it's green. When the squiggles are going too fast, it might show as red or yellow or something like that. So it makes a color-coded map based on how quick the electronic signals is. Okay, so he takes that from normal and then starts applying all these disease EEGs and realizes that there is a distinct normalcy to every organ system in your body, and you can see when it's too fast and when it's too slow. And he started using other people's published research on how to tap into the autonomic nervous system to create a texture that he originally sewed into socks, and see if he could turn off signals back to green for ease of understanding.
Right.
And so he had socks, and the point of those socks were to improve balance, and this is for mom. Like the first pair was mom. And he's like, this is not going to cure your MS, but we should have balance. They work well. He started making these socks in high quantities in Canada. He's Canadian, so there was a Canadian company that made them originally, and they sold them to a lot of athletes, really hockey players.
Okay.
Since the majority of injuries in hockey are off balance injuries, so they made these socks as athletic socks. They had older people wearing them, and then they had young kids playing hockey wearing them. And then, as he says, one night he's in bed reading, journals while his wife is trying to sleep, and he reads in a journal and an article that wound up winning the prize, believe it or not, that talks about anyone somewhere in the skin, they have these what are called ion channels. And ion channels are the way cells communicate with each other. So just think of them as like little on-off buttons, you know, or a light switch, for lack of a better word.
Right.
Each cell has these little channels, and if you send off ion channels at a very particular pattern, it will send a signal to the brain that that's either something bad or that's something different. The brain will make a reflex change based on it, and it doesn't matter where in the body that signal is. If it's on a part of sensate skin, it doesn't have to be sleep.
Right.
This will happen. That's when he had his aha moment. Wait, it doesn't have to stop. It could be like just a patch. You just wear it when you want, right?
Patch, right.
Yeah, exactly. Or a Band-Aid patch, right?
Yeah.
So, and I keep one on my hip. But then he also started experimenting in how many other parts of the brain you tap in. So when you tap into the sensory aspect of the brain, right up the brain stem, the medulla of the brain that's right next to the cerebellum. So you're going to capture both the person's ability to balance themselves, but you're also going to capture the very most central aspect of the cranial nerve, including the vagus nerve and the autonomic nervous system. So that first patch is essentially heel and stick sock, and it is designed almost like the control alt delete or crazy brainwave. It just gets everything back to normal. Now, the second you take the patch off, back to that's what it is. But so if your balance is off, when you put the patch on, you can see an EEG change in 10 seconds, 5 to 10 seconds. And the patient can demonstrate in their balance facial perceptions while wearing the patch. Take the patch off, wait 10 to 15 seconds, the effect is gone. So it's not a placebo effect. You can demonstrate it with EEG, and you can demonstrate it with a physical exam. So now he's taken that concept and expanded it to other aspects of the autonomic nervous system. So
right.
There's one for anxiety, there's one for focus, there's one skin circulation to give you kind of a glowy skin. There's one for men for testosterone, erectile dysfunction kind of a thing. Women are too complicated. He said more than one patch would be required. But for men, it's just one pathway. So if there's one pathway, you can buy a patch, stick it on your skin, and improve it. Now, if you're someone who, let's say, for example, he has one for sleep. You wear it at night. It's not going to make you sleepy. You can wear that patch and walk around. It's not like you're not going to feel off kilter. If you're someone who doesn't struggle with sleep, you're not going to recognize that this patch has helped you anymore. If you're someone who's downing caffeine right before you go to bed, this patch is not going to override chemicals.
Right.
But if you're someone who just kind of struggles to fall asleep, nightly use this patch over the course of their study was a 2-week period of time. If you wear it every night for 2 weeks, you'll find you go to bed 30% quicker and you sleep 30% more soundly. And so it's like a chronic use, and it reorganizes the pathways in your brain that are responsible for sleep. So that's just the sleep example, but it happens in all the different pathways. His pain patch, I don't know if you saw that paper.
I did.
So it's all, yeah, so 80% of people's chronic pain comes from the central aspect of their brain and the amygdala and this constant rumination over ouch, that hurts, and this patch that tells your brain, stop. No drugs in it. There's no batteries required. It doesn't look like it's doing anything. No, you're wearing one. It's like a Band-Aid.
It is.
Right?
Yeah.
And so the motion of your skin is what trips off the ion channel. Now, I will say say this, those ion channels also require immunity. So the way your body talks to itself, that, oh, there's a viral invasion or you're allergic to something, is with these ion channels. So he does have a patch that will improve your brain's control over the immune system. It's called the Defend patch. And so that's the kind of thing I have
This one right here.
because it'll keep, yeah, it'll kind of, like, it's not antibiotics.
Right.
You're not going to cure TB with that, but it will optimize your immune system. So when you're traveling, you're less likely to get like some form of airborne illness when you're traveling. Rip it off like a Band-Aid, it will cause a cellular immune response that lasts for days. And I don't know if you've ever gotten one of those hickeys patches. One of the complaints people have about the patch, let's take a patch, especially a sleep patch, because it's stuck on for 10 hours and you wake up and peel it off. If you peel it off too quick, you'll trigger a whole bunch of ion channels you didn't mean to, and it will call the immune system into the area. It can cause a little bit of a rash. That's not an allergic reaction. That is a bazillion ion channels all going on at the same time to rip it off. So the company typically suggests use soap and water, get in the shower and let water get under it, and then it just peels right off. We never have that rash.
Okay.
Just as a FYI.
It's important.
That's an important FYI. Because some people will get that rash and think, oh my God, I'm allergic to it.
Right. Right. And it
Well,
might
it's,
be-
but there's no contraindication. You can be pregnant, you can be old, you can be a child, any medicine, it doesn't really matter. If this technology, if you can feel in that part of your skin, for the NFL, he has an athletic patch called the victory patch. What's actually in the mouthpiece for football players in helmets that touch you just need the smallest little piece of skin that has sensation and it will send a signal. It doesn't have to be a long patch. And so he's always coming up with new, different ways to get that technology on. It's kind of fascinating.
Where do you think it's going to be going to?
This is my thoughts. So, and I do sit on the medical board. This is why you asked me to talk about this technology, but I sit on his medical board. One of the things call each other, or I'm not each other dirty. And in my both Eastern and Western medicine, very reflexive. The person comes to disease and then offer a medicine, a kistis, an herb, a tea, whatever. And so it's funny because the Eastern guys complain about the Western guys writing prescriptions, or prescription guys complain about the Eastern guys, ringing bells and shining lights in people's eyes. But that philosophy of waiting to get sick is consistent. Medicine, which is why there probably are no healthy people. So the whole point would be, as a doctor, wouldn't it be this? And so it is possible if you could do a couple of things. One would be to control the toxins in your environment. Now that is very good. The second would be if you control the human microbiome, which seems to be responsible for all the human disease. And then if you could take the brain, which we use 5 to 10% of maybe, and keep it in a position of neutrality so it doesn't get off center. Jay, the owner of the company, sent me a paper the other day, which kind of deep in the weeds, but it was interesting. Because, and obviously the person who wrote that probably does not know about his technology. What is interesting is a lot of PhDs around the world, he would physically call, email, write, go visit in person, and without exception got kicked out of every single office because he's an engineer. He's not a neuroscientist, not a doctor. He doesn't have a PhD. He's an engineer. They blew him off completely. They may not even know this technology exists. But so they were positing in this thing interestingly, the autonomic nervous system can control all organ systems. Of course, Jay has already figured that out. This paper also said, interestingly, the EEG in disease states is different, and you can diagnose disease with an EEG. And of course, Jay already knows that. So I think the first thing that potentially will happen is that physicians or even kiosks at Walgreens put a little helmet on you, figure out which neurologic system is out of whack before symptoms even showed up. Because as it turns out, these EEG waves occur to compensate for a disease process where you, the patient, can really recognize symptoms. So I think the first thing is you might have in airports and Walgreens, just like they got blood pressure cuffs, little blood sugars, stick. You might even have a watch that does this, or a little baseball hat, whatever, because the mobile unit that uses to demonstrate the effects is not that big. I don't know how much, but it seems like step one would be diagnosis at an early state before damaged tissue occurs. That would be ideal, right? The second thing is, could you possibly, after finding that area and getting it back to normal, could you potentially permanently control a person's microbiome? In the microbiome has been that's the bacteria in your intestinal tract. As it turns out, it's probably in control of the origin of this disease. So if your microbiome is not functioning properly, you've exposed yourself to a certain amount of diseases, and they can demonstrate that. They can give diseases to people through fecal transplants, which is why now that's so tightly regulated. You can prevent diseases with fecal transplantation. That's the microbiome. So we're working currently on a study to figure out exactly what texture would one need for the brain to talk to the microbiome, and to know that he's going to do a study where we parallel EEGs with people with microbiome, and you can physically test the microbiome. So once you've mapped everyone's microbiome and then you correlate that to an EEG, he ought to be able to figure out he's the only guy who knows how to do this. Everyone else is guessing. He's figured it out. He knows it, and he won't tell anyone how he does it. It requires 2 supercomputers, but he's been able to figure that out, and he may be able to know, look, based on this you could send in a stool study. And he might know instantly, I can guarantee this person has this problem based on that stool study. Here's the patch for you to fix it. So it goes kind of into the brain-gut parallel connection. So I think it has the opportunity, which is one of the reasons why he will never sell his product. Like, this represents an enormous threat to the pharmaceutical industry. Because there may not be any medicines going forward, right? So if you could do that, this is an over-the-counter that's not going to injure you. Like, if you took grandma's blood pressure pills and took all 30 of them, that might kill you. You could slap 500 super patches on your body. It's not going to change anything.
Right.
One patch is all it takes to get you. So it's a safer platform. The mentality is find disease early, or there is disease. Once there's disease tissue, what can a patch accomplish? Right?
Right.
It's not gonna replace your surgery. It's not gonna prevent your cancer. What you're trying to do is figure out where in the disease process can you intervene so that you're less likely to need an operation, get a cancer, get a metabolic disease, an autoimmune disease, et cetera, right? So I think the future of the technology is going to be that, and then that puts everyone's health in their own hands. And in an era where most countries spend half of their tax dollar income on healthcare dollars, yet people are sicker than they've ever been. Doctors my age are retiring, en masse, because we just don't get paid And they're really not training the young doctors. But I just saw they want to shorten medical school to 3 years and do like a 1 year residency program. You're not a doctor at that point. You've gotten, like, that's crazy to me. But that's what they're doing with your healthcare system. So I highly suggest not waiting until you get sick to take a trip. You know, you'll wind up, they'll get to a point. As this stuff is, it's so highly complex.
Right.
Your brain does all the work. It's fascinating. Like alien tech, I'm convinced he was abducted by aliens. He says he was not.
That's great. So, what patches do you currently align yourself to? Because I think that's the biggest thing. You made a statement is that if see any benefit.
Right, correct, exactly.
Yeah.
Right, so I'm a pretty happy-go-lucky person. So he's got a patch for depression called Joy.
Yep.
It helps people with depression. I think where that is not going to change anything. Now, I'm under uncommon amounts of stress. And it is like in a large, in an experiment, where so I bought like a year-long membership now. And every time the office calls, I get a blood sugar. At night when I'm sleeping, if the text goes, if I have a big surgery the next morning, my blood sugar is like, stress is my problem. So I use Peace Patch. That's the one I am wearing right now. I'm wearing two right now. One is a Liberty Patch, because that's your brain central microbiome. You know, if I eat that gut health is the source of all health, and I do. And in fact, Hippocrates basically said no manner of brains is worth a good set about. Like he knew 4,000 years ago that the number one way to have a healthy person is have a normal and healthy digestive tract. Now, if he knew that 4,000 years ago, why have we kind of forgotten that? But so I wear a Liberty Patch because it's good for vagal nerve stuff. I also have an autoimmune disease which affects my joints, a little bit of my balance. So I want that for my balance. And then I wear a stress Peace Patch. And on my blood sugar monitor, if I've got those two things on, I do not have the crazy blood sugar spikes unless I eat something that's high in sugar.
So you find that has calmed spike.
A lot, yes. That calms a lot of things down. It helps me maintain my muscle mass. I'm trying to get in shape. I'm trying to get rid of some, arthritis situation. And for 2 years, I wasn't able to do any exercise. But between the Freedom Patch, which is for pain, so I wear that. I'm exercising so I can work that joint. My Liberty and my Peace. I mean, honestly, in the last 3 or 4 months, it's made an enormous impact. It doesn't happen overnight, obviously, because the human body doesn't turn on a dime. Your EEG will turn on a dime. The stress patch EEG looks the same when you wear it as if you took someone who's just been meditating professionally for like 6 hours. So if you took a Buddhist monk who's been meditating all day long, he can actually calm his EEG down, and you can do it in 5 minutes with it. So for me, I like the Peace Patch because it definitely makes me feel more zen. I'm 280 to meditate. So for me, I find that to be.
You'd have to go back for more school to learn how to meditate.
I can't do it.
I know.
So Peace Patch for me, baby. To me, that's the money. And I have told Jay, Peace Patch is the money, and it's doing much more than just alleviating stress, because when you combine a Liberty Patch and a Peace Patch, those two things, both the adrenal axis and the brain, both directly control gut health and the microbiome. So in my opinion, somewhere in these two patches, and maybe may or may not have the technology to find the third puzzle piece. But his microphone, but he has patches that needs to fly to see if that doesn't affect my opinion.
So do you think that the victory patch has some of that balance?
Yes.
That performance? How do those intertwine, right? Because people are.
Yes, they're very similar. So the Liberty patch and the Victory patch are very, very similar. The Liberty patch seems to hit a lot, like the parasympathetic autonomic nervous system,
Okay.
whereas the Victory patch has a tendency to hit more cerebellar. So, but the original thoughts actually hit both of these pathways. So I'm sure, and he would never say this, but I am sure from a marketing standpoint, if I hit two products out of it, I'm sure that's what that's thinking. But basically, the original thoughts were both.
Okay.
But the peel off, but you can't get the thoughts out.
Right.
So it's these two. If you're out playing football or rugby or hockey, you're not really interested in gut health at this moment. Right?
Right.
Put that one aside.
Right.
Get the full spectrum of the athleticism. Like that is the NFL players, Olympians, professional golfers. I mean, name a professional sport. They are all wearing that. Collegiate D1 athletes, want to be professional athletes, are all wearing that. It improves their rate of speed, their rate of recovery, their reflex, their timing, in just your athletic ability to be ramped. I mean, by 20 to 30%. There's a study coming out of University of Arizona where they use the football team as guinea pigs to physically demonstrate how this works on a football team. A lot of their other sports are just with regular people kind of doing exercises.
Sure.
So they took an entire football team, University of Arizona, these are top D1 athletes, and put them through the rigors to see exactly, like you've got a prime athlete, now slap the patch on now. Right?
Yep.
That's paper. Yeah, no. That paper. So it is interesting that some older people have mobility issues. Usually you would think, look, Liberty Patch is going to give you a little bit of your brain, a little bit of your balance. And so I always start old people Liberty Patch. My mom, I got her on Liberty Patch. But some of these people really are struggling with athleticism, might actually need a Victory Patch. Because they're trying, to them, getting out of a chair might be this Olympic event. So you kind of have to, from a clinical standpoint, you kind of have to play it by ear. The danger of lay people using patches, they try to associate, oh, if I have this disease, can I use this patch? Not really disease specific, it's more of a symptom specific issue. And a lot of symptoms are as a result of multiple physiological processes. Could be wrong. So the company has to be very cautious with what claims it allows people to make. I mean, it's not going to, doesn't replace your doctor. Right. It may not replace any medicine. But, you know, he's got one that actually will lower your A1C and you can't bring it to market because that claim is not allowed by the FDA. So all of his patches are FDA registered. They're not medicines, so they can't approve a non-medication. But it's a medical device like K-tape or an ACE wrap or, you know, braces and whatnot. These are FDA cleared devices. So all these devices are FDA. One that truly done the study and it lowers your A1C. So in other words, it helps maintain blood sugar control. You can't bring it to market for that because that indication is so tightly controlled by the FDA.
Throw in something else in the mix, right?
Well, that's exactly right. And I think at one point, I'm sure he's got collateral studies right now. Studies, throw this shit on, tell me what else.
That's right.
You know, right. And then you can set, you know, it's interesting because I'm developing a blood sugar thing with be able to say something to that effect on the herbal supplement. And so I find it fascinating he's not able to say that on his product, and I don't know why. It has something to do with FDA regulation. And of course, he's in the crosshairs of pharmaceutical companies that have already offered him $1 million for his technology to produce itself. So he does not want this in the hand of the pharmaceutical industry because they'll box it and no one will ever see it.
That's right.
Like this is a
Put it on the
cheap
shelf.
answer for everyone around the world. You know, there's small countries with no money, people living in tiny little villages who do not have a pharmacy, no access to that. This doesn't spoil, it's easy to use, doesn't cost much money. You know, it's like, so this is a way to disseminate health. That pharmaceutical industry. so, so anyway, he has to be very, very cautious.
It's claims.
Claim,
Right.
yeah, so you just cannot make a claim. That's why I'm very careful to say, you know, it's not putting you to sleep. You're putting yourself to sleep. It's like a crutch, you know, when you twist an ankle. The crutch didn't heal your ankle. It supported your weight while your body was the same concept, except it's a neurologic crutch.
And you're not ever going to really fix that condition. And probably a lot of it has to do with the fact that as we get older, just like your computer, you start having repairs, start replicating.
Correct. And this was in the paper he sent me. There was an interesting statement that may reverse my concept on fixing. The brain has something like there's homeostasis, which we talked about, where everything is in balance.
Right.
The brain will achieve something called allostasis, which means if the sensory comes up enough times and the brain can't fix it, the brain gives up and says, screw it, I'm going to the new level. Your blood sugar kind of does that too, you know. Like you have normal blood sugar until you wear the system down. Next thing you know, boom, your new set is now 130 instead of 100, you know. And so that's called allostasis. You can put the brain into allostasis and you can pull it out of allostasis correction. And the question is, how long does that take? Probably years and years and years and years, because the brain waves are off long before the station. So my question is, if you wore this patch for 10 years, there is a possibility, in theory, based on that one paper, I don't know, maybe that would happen, but you'd have to wear it 24/7 for a decade, probably, for the plasticity of your brain to get to where it doesn't need it. If I had to make a guess. And if you disease the body enough, there's no going back. I mean, you know, the second you have to replace the knee, like that's never the same. Even though you're walking on it, the neurologic intervention of that's never going to be the same. So obviously, I don't think you'll ever get a permanent fix. But never say never based on that paper. Brain is capable of permanent. But they just don't know for that happen.
Repetition, duration, consistency.
Correct. Yeah, it is also interesting that they can do an EEG and determine if you're going to age gracefully or not. Right? So they can.
Have you had that?
I have not. No, and they didn't really describe. This is literally like 2 paragraphs where the guy starts talking very factually. So I don't know. That's in this slide. I haven't, but literally discussed it that there is this fact. There's a part of your brain that's the me that knows that you're alive, right?
Yep.
There's the me factor. The me factor is disease in autistic. This is why they can't interact with other people. They don't have a starting point of me. And of course, I told Jay that is fascinating because factory on an ECG.
Right.
Trust me, he'll figure out patch, put on off, give their lives back. Can you imagine what that would do?
Amazing.
You know, it'd be without trust. Can you imagine? So, so anyway, so there's a part in your brain that even at a young age go off the rails and outline this is someone who's not going to age well. So obviously there's something already gone wrong. The brain is already trying to correct the pathway, and with many years of no one knowing if he's on, boom, all of a sudden. So the fact that that was written in a journal article means either someone theorized it, now go find it, or they found it and don't know what to do with it.
Right.
But yeah, Kenny's like a dog on a bone. If it's theoretic, he will find somebody. He'll probably find the author of that paper and communicate. You know, where did you get that data from?
Right.
And that person may or may not talk to you. But can you imagine? That would be great. Like if you
They'll
pick
talk
up
to you then.
Yeah.
You know, I mean, you got to put JRM behind you.
Right.
You know?
Well, I feel like the recent presidential debate where you had one guy staring off into space, messenger, getting voices from beyond. I could just listen to Jay right there in my ear.
That's it.
And then know what to say. You know, how to answer my question.
Exactly.
You know, and all that.
You know, well, we'll figure it out one way or another.
But the theory is there. So I think alien medicine, Star Trekky style, is actually close to being not a theory, where you can have a scan and know there's a problem, right? Of course, the Star Trek world is the whole body.
Sure.
Looking for a disease body process, and it's probably not going to be that. It's going to be up here, or it's going to be a test from a microbiome.
Right.
It's going to be one of those two or a combination. If I had to make it. And it might be close to that.
Well, I mean, if you think about it, you've got dogs that can smell out cancer, maybe before it's even detected, right? So, you know, if we think the smartest, brightest, not, right? We're missing something. We're missing something. You know, we've got all these other things going on from lab or a golden retriever that can, you know, determine if someone has cancer prior to even.
Or diabetic, or you're about to have a seizure. I mean,
Right, seizure, exactly.
Dog, you can sense you're going to have a seizure before you collapse and have a seizure.
Right.
Dog will actually alert the patient. They can sit down so they, you know, stop driving, park the car, or whatever.
Right.
For safety.
Yeah.
So we know this exists. The question is, how do we have things that obviously natural? And so I do find it